Basically, one muscle is from the vertebral column and another muscle from the iliac fossa of the hip bone. So two muscles, one from vertebral column, another one from iliac fossa. The one arising from the vertebral column, you call it psoas major. There is another muscle, psoas minor, but we don't need to worry about that. Psoas begins with the letter P, right? And then the muscle arising from the iliac fossa, it has got the name iliacus. Easy name, iliac fossa, iliacus. Both of them, they unite together. It looks like that, right? Both of them, they are uniting together, and will be inserted inside the greater trochanter of femur. So they are the powerful rotator of our thigh. They can rotate, all right? Just this. Now look at the hip region. There are three gluteal muscles. There are several other smaller muscles, but we don't need to worry about them. Three big muscles over there, gluteus maximus, gluteus medius, and gluteus minimus. The one right here, this is the gluteus maximus. Okay, gluteus maximus. And right here, the bigger one, there are two, medius and then minimus. Okay, there are two muscles you can see, completely separate two muscles. The bigger one, medius, the smaller one, minimus. Okay, minimus. These are the small muscles, you don't need to worry about them. Okay, so hip region, done. Now the thigh region. Thigh has got three compartments. We are going there, but before we go to the compartments, can you see something like a big white band right here, band of connective tissue? Band of connective tissue right here on the lateral side. You can feel that connective tissue on the lateral side. That's called iliotibial tract. Why it's called iliotibial tract? Because it begins at the ilium, ends up at the tibia, and it's a tract. It's like a plate, or like you can say like a fascial sheet. This type of things. Okay, so this is something like this. And what we do here, we have got one small muscle over here. That muscle has got the name called tensor fascia lata. Why tensor fascia lata? I'll explain. See the muscle, tensor fascia lata. Because this iliotibial tract, it has got another name called fascia lata, because it's the lateral fascia. In Latin, lateral fascia. Fascia lata means lateral fascia. So this muscle is tensing this fascia lata. What happens over here, like funny name, right? So when you stand, it stabilizes your hip joint over the knee joint. So that's why we don't fall sideways, okay? This muscle. And how do you adjust our posture? This small muscle over there, it will contract and relax. Even we don't have to notice actually. It will automatically adjust our posture. All right? Tensor fascia lata. Now let's see the real compartments. This is the anterior compartment of the thigh. Anterior compartment of the thigh is also called extensor compartment. There we have got four muscles, main four muscles over there. Rectus femoris. Quadriceps femoris is the name. Very good. So rectus femoris should be the one right here. Rectus femoris, the middle one, straight middle one is the rectus femoris. Three vastuses. You can see the vastus medialis right here. When you bend your thigh, you can see a little bulge in the medial side. That is the vastus medialis. When you flex your thigh, you can feel little bulge on the lateral side. That is the vastus lateralis. So how to see the vastus intermedius? To do that, you have to remove the rectus femoris. Then you are going to see the vastus intermedius. Before we remove the rectus femoris, can you see one very long muscle? What is that? Sartorius, longest muscle of our body. This muscle is kind of like, weird, because it covers actually two compartments. It covers the anterior extensor compartment, so sometimes it acts as like extensor muscle, and it is also the part of our medial compartment, so it can also like adduct your thigh. So sartorius has got two jobs to do. So that's why I didn't mention it as a member of the anterior group. It is, but partial. It is also the member of medial group. In the medial group, we have got three muscles, but before we go to the medial group, let me show you the vastus intermedius. So here is the vastus intermedius. Underneath the rectus femoris, when you remove the rectus femoris, then only you will be able to see the vastus intermedius, right? Otherwise, okay. So now let's go and see the muscles of our medial compartment of the thigh. In the medial compartment, we actually have got several muscles over there. The medial compartment, to do what? Medial compartment, what do I say? Adducts your thigh, okay? Adducts your thigh. So adduction means this movement, okay, bringing your thigh closer, okay. So there are several muscles, as I said. This is the first muscle right here. This is the most medial muscle of our body. You can actually see it like one straight line, most medial muscle of our body. Sorry. Okay, so this is the gracilis, okay. This muscle is called gracilis. This is the most medial muscle, gracilis, okay, gracilis. And then what? Then we have got another small muscle right here. Can you see this small muscle right here? That's called the pectineus. This muscle is called pectineus. Next to the gracilis, this muscle is called pectineus. What else? We have got 3 adductor muscles. Okay, adductor muscles, 3 adductor muscles. So those 3 adductor muscles are really difficult to see. So here they are, okay, here they are. So we have got adductor longus, adductor brevis, and adductor magnus. One adductor is very long, all right, very long. So actually this is the adductor longus. And you don't see the whole part because this part, only the part you can see, other parts are hidden behind other muscles. And the fibers right here you see, that is the adductor magnus. And adductor brevis should be somewhere there, that's one very small muscle. So anyway, if I give you this type of things, I'll actually just give you one option to find out, either adductor